We have one more poster presenter, and that's Dr. Carlson.
So she has been a nurse for over 40 years, 20 years in mental health, 20 years in school nursing, and 8 years teaching public health. Her credentials include BSN from University of Virginia, PhD from University of Phoenix, Psychiatric Institute of Washington, UCLA, NP Neuropsychiatric Institute, Northbridge Hospital. See some of the places that she practiced. She shares her enthusiasm for public health with nursing at West Coast University. 8 years, she's been there for 8 years. She does BSN clinicals currently as a full-time professor since 2017. Let's see. Her belief is nurses have a responsibility to be active advocates in their professional organizations and at a minimum vote in every election. She's a member of STTI, NASN, and CSNO government relation committees. Previous organization affiliations, Los Angeles Council of School Nurses. She was a past president, and the American Heart Association. Let's welcome Dr. Carlson.
Hello, and thank you for having me here. We've dealt a lot with COVID, and COVID is a big public health issue right now. So my presentation also has to do with what really public health was about, an issue that public health was about pre-COVID. I always tell my students that public health, you want to think big. And with your patients in the hospital or your clients, you are looking at the symptoms of society. So take those symptoms of society, and if you apply public health principles, we can keep a lot of people out of the hospital. So I just wanted to present that and get a connection with what we've been talking about. It was June. It was a Saturday. I was packing up for my first trip to the University of Virginia for my summer session. I was really excited, panicked, of course. And so that was the Saturday. On the Sunday morning in the middle of the night, we got a call. It was about 2 or 3 in the morning. I got a call from my stepmother that my father had passed away. He was 53 years old. He was on his 4th MI, and it was at a time where they hadn't perfected bypass or any kind of stent surgery. Fast forward 7 years later, I'm in California now. So I get this panic knock at the front door. And I open the door. This woman is frantic. She goes, "Does anybody know CPR?" And I'm thinking, oh no. So she takes me next door. I am presented with it was a young infant, a young toddler, and he was blue, not breathing. He was a drowning victim. So this was my personal experience with CPR, other than my training for my practice. And I like to tell that story because I find it interesting what people talk about. And I always wonder why. There's a big reason why we all talk about what we do and our interests. So it started off there. Before COVID, sudden cardiac arrest was the leading cause of death locally, nationally, and worldwide. And out-of-hospital cardiac arrests are usually witnessed 50% of the time. And of the 50% witnessed out-of-hospital cardiac arrests from sudden cardiac arrest, only 36% receive CPR. And most of these are in residence and they're witnessed by family members or friends. And we all know that early CPR in 4 to 6 minutes can really improve the survival rate of the victim. So a trained bystander is more likely to do CPR. younger people are more willing to initiate CPR and perform CPR on a victim. So one of the things the American Heart had suggested, high school students could be trained in CPR as a possible solution to increase the number of trained bystanders. California, I used to work in LAUSD, and California, the K through 12 school curriculum recommends CPR in schools. Now, it's not being done. All right, and this was before, at the time that I performed this. It was actually my dissertation and my research. At the time, a bill was in the California Assembly, bill, I believe it was 1719, and it was its third attempt. So they kept presenting bills on training high school students in CPR. It just wasn't passing. The rest of the nation they were passing it, but California just seemed to be delayed. What was the problem? And so the majority of the research that was out there centered on learners. So who would be the learners, and also on teachers. And they left out a key component, which was school nurses, who are your medical professionals on campus. So why not ask us, how can we help? What can we do? What do we see as the gaps? So the knowledge of the school nurses, that we didn't have that was a gap, as well as why it wasn't being performed when it really is in our curriculum. And health is a mandatory graduation requirement in most of the schools. All right, so this is my dissertation title: Cardiopulmonary Resuscitation in Schools, School Nurses' Perceptions of the Barriers and Recommendations. All right. Uh-oh. Why aren't we? Okay, so this is the problem. I told you about cardiac arrest. Research questions: what are the school nurses' perceptions of the barriers and recommendations of integrating cardiopulmonary resuscitation in schools? Yeah. So I use King's, the theoretical framework was Imogene King's conceptual systems theory. And this is where I believe, this is a personal belief too, that individuals, meaning a nurse, can affect groups of people, other individuals, who then affect society. And this is what, if we train high school students to do CPR, we can actually affect society and possibly reduce the number of out-of-hospital cardiac arrests, or at least improve their survival rate. So I'm a big fan of Imogene King. Research method and design: I used a qualitative descriptive research method. I explored the perceptions of school nurses through individual interviews and asked semi-structured questions and demographics in my questionnaire. My research design was non-experimental. It was a qualitative descriptive approach, and because it was perceptions that are not quantifiable. So I summarized the data, and during this time, you can stay close to your data. You don't have, it's not statistically configured. So I used a thematic analysis of the data. I found that the barriers that the school nurses stated was funding. Where do we get the money? Where does the school district get the money? And that's one of the big drawbacks in not instigating CPR. Time. And in this day and age, we're so focused on the academics that the rest of the material, the health, etc., is not necessarily being taught. And there was also a knowledge deficit of the nurses. They did not know the various forms of programs that you could teach CPR. The recommendations were further education. They recommended CPR, that it be taught in school, and that we needed to advocate for it, whether it's with the Board of Education, your local school board, And with me, it was, I was on the government relations committee for the school nurses organization. So we see all the bills coming down and we can support them or, you know, decide what we want to do. So having our recommendation or our support is also very important. So the implications of the study and the results, it was the California Assembly Bill, AB 1719, was passed in 2016, which was wonderful, but it wasn't even coming into play until the school year 2018. Well, it only had 1 year to, excuse me, to get going before COVID hit the next school year. So we don't have any results as to, you know, how it was an effective teaching. Did they even get going with it in some of the health classrooms? So you can see this is a nationwide map for the United States, and actually globally, some other countries are so far ahead of the United States in teaching this. It's incredible that we are so far behind. You can see California there is 2018, and that's when the law went into effect, even though it was passed in 2016. So most of it was before, and there are a few that either the bill has been introduced, it's recommended or not required, or nothing yet. So nothing yet are the light gray, light blue colors. And so the conclusion is the significance of the study. Here it is, CPR. They decided.
If you see a teen or adult suddenly collapse, it's important to act fast. Helping to save a life is easier than you might think. Just start hands-only CPR. The first step is to send someone to call 911 or call 911 yourself. Then get directly over the victim. Put the heel of one hand in the center of the chest, then put your other hand on top of the first. Then push hard and fast in the center of the chest until help arrives. It's important to push, giving 100 to 120 compressions per minute, which is about the same tempo as the song Stayin' Alive. Let's hope you never have to use hands-only CPR. But if you see a teen or adult suddenly collapse, don't be afraid to try it. Remember, call 911, then push hard and fast in the center of the chest until help arrives. Your actions can help save a life.
All right, so compressions only has been the choice that most high schools use, and it has to have, according to the law, it has to have an AED component. So, you know, look around, find out where all the AEDs, they should be in most public places, airports all around. They're at Costco, Target, you name it. They have they're supposed to have AEDs. So thank you for listening. And I want to thank the ResearchGate for an opportunity to share my material, my research. Are there any questions? Oh, thank you.
Thank you for your poster presentation, Dr. Carlson. That I was not aware that that was a initiative to train high school students to do CPR. You know, obviously, I'm aware of the presence of AEDs all over the community, but really and truly, when I was listening to your poster presentation, I began to think of some of the young athletes who have had sudden cardiac arrest, and the ability of perhaps saving those MI victims with having high school students trained, and more saturation out in the community would improve patient survival.